Hi, my name is Jorge, and today we're going to be talking about Robin. Robin is 11 years old, homeschooled, and diagnosed with type 1 osteogenesis imperfecta, or OI, as a toddler. She will be attending middle school for the first time in her life. She, however, took a fall recently, and her parents are concerned about her going back to school. They have requested an occupational therapy evaluation to help identify any areas of concern that Robin might be experiencing attending a public school for the first time. Um, I will be acting as the occupational therapist in this scenario. Robin's medical evaluations have shown no skeletal deformities, just that she is prone to the occasional fracture. As a result, her ability to safely engage in play and leisure activities while at school, particularly alongside peers, is a concern for her. Another concern is medication management. Robin is used to taking her medication throughout the day at home, with cueing by her mother each time. Her ability to then safely and routinely engage in health management at school is a concern without her mother being there. As far as strengths are concerned, Robin has always been an intelligent and applied student, and she's always eager to participate and engage in academic activities. Her ability to participate in education activities and also engage in student occupations should be an area of strength for Robin, given her background at home. Also, given her early diagnosis, Robin has learned throughout her life how to manage her condition to the best of her abilities. So, what she lacks for in speed during physical activities, for example, which she has to in order to be extra careful, she makes up for in stamina. So, her ability to endure and pace herself while sustaining active performance at school should be an area of occupational strength for Robin. Next, I'm going to discuss the underlying factors and characteristics of OI that need to be addressed during the assessment and intervention plan, and also why. The three that I picked, the first one is that OI is often characterized by hypermobility of the joints, and if this affects the hands, it might cause deficits with handwriting and other things that could cause discomfort or fatigue. Given this, I think it's important to assess Robin's handwriting, the quality, the grasp, her ability to engage in tasks repeatedly for extended periods of time using her fingers. Next thing that I wanted to check on is that children with OI may demonstrate decreased strength or muscle weakness or low stamina while they're doing gross and fine motor activities. So Robin feels that she can go the distance, but she has not often participated in big movement activities like she would be expected to at school. So this is an area that needs to be addressed as well before she goes to it. As the AOTA explains, it's important to assess her ability to engage and participate in physical activities so that we can determine what may need to be incorporated into her daily routine in a way that enhances her performance. Lastly, in terms of improving her overall health and decreasing risk of accidents in the future, assessing Robin's engagement and self-care skills may be helpful as she increasingly becomes more independent from her parents. For children with OI, activities like washing or brushing your hair or toilet hygiene, for example, may be difficult due to movement restrictions. So it's important for us to assess her independence with these tasks, as she will no longer have her parents around during the day to help her out if she needs it. Now that we've identified the areas of concern, let's identify appropriate practice models to engage. For Robin, for example, a good model of practice to guide interventions would be SCOPE IT, or the Synthesis of Child Occupational Performance and Environmental in Time model. Hurdle described the model as one focused on the child's growth and engagement in occupations throughout development in order to enhance the occupational performance of the child. So it analyzes the client using both either a top-down or a bottoms-up perspective, depending on how you want to do it, with focus placed on occupational engagement in particular, performance components, and environmental factors that are affecting performance at that developmental stage. By identifying all the strengths, the barriers, and motivational factors across these areas of occupation, the model itself emphasizes a more holistic approach that, at the end of the day, also takes into account the temporal factors of engagement in occupations, and that's important since we're measuring as well the transition from home to school and how the change in the environments affects performance for Robin. In order to address any problem stemming from muscle weakness or fatigue, another one that we could use is the frame of reference for motor skill acquisition, or FRMSA, which would be ideally employed during therapeutic interventions with techniques and other strategies relevant to their specific conditions. Kaplan was the one that focused on the child's ability to carry out a given task, including how the task itself affects the engagement and the skills required to do it. It emphasizes the role of regulatory conditions as aspects of the environment that affect specific movements, and this is important as we transition from the home to the school. Within this frame of reference, the child is front and center, and by using this information, we can act as facilitators to structure learning activities that promote their ability to perform other tasks, such as occupations involving school, like she will be needing to do. Next, in order to address all these concerns, I would suggest using the following assessments. As Robin is starting her participation in the school setting for the first time, I think an important component to assess would be her overall self-perceived abilities and how she feels about her academic performance beyond what the parents are reporting. For that, the small C would be a great inventory that allows therapists to assess Robin's learning strategies, academic motivation, test-taking strategies, and testing anxieties. These are all important areas to assess at this point, since it's probably all going to be new to Robin given her history of homeschooling. It's a very different environment. The small C has several forms, but in this case, the school and the home forms will both be appropriate, especially as it has a function to determine differences in between one setting and the other and how those can affect each other. In order to address any possible deficits with handwriting, grasp, and fatigue with fine motor skills, we can use the VERY BMI, or the Developmental Test of Visual Motor Integration. It's a bottoms-up assessment measure that measures visual motor integration, visual perceptual skills, and motor coordination, and it's easy to administer to someone like Robin. With the VERY, we may be able to determine Robin's H-equivalent score in these areas compared to her peers and easily find out if there are deficits that need addressing. Next, I'm identifying two occupation-based outcomes based on my case and why I'm predicting these outcomes. So I'm predicting that Robin will be able to identify physical education activities that may require too much physical exertion and request a modification from the coach as a result. Just based on her overall lack of skeletal deformities, her main issues are more about identifying areas of concern before they become her problem. So her ability to judge what is best for her beyond parental supervision is a skill that she can develop on her own, and we can help her with. The other thing would be that Robin will be able to take her medication throughout the school day, using her phone as a reminder without forgetting. The value of repetition can reinforce behavior for Robin, and in this case, being reminded that she can miss the medication will help ensure she grows used to doing it on her own without her parents having to remind her in the first place, which is no longer an option once she's, not home and back at school. Lastly, I'm listing two COAST goals for the client and how they will measure, and how will we measure. So, the first one, I will read those. Robin will engage in therapeutic activity to express understanding of safe versus unsafe actions during gross motor tasks and group activities, given verbal scenarios or visual flashcards by demonstrating improved safety awareness during simulated school activities within 6 months. 2. Robin will demonstrate I'm so sorry. I kind of lost that one. Robin will